Hi, my name is Julie, and I'm going to give my presentation on how the endocrine system is involved with the subtle mood and behavior changes in the canine Addison's disease. So my AI gave me my project topic in more of a case-based study way, so I'm going to walk through diagnosing a dog with Addison's disease and why early recognition is important. So let's say this dog in the picture over here just came into the ER one day because he collapsed during a walk. He was later diagnosed with Addison disease, but prior to the collapse during the walk, he had lethargy, he was skipping meals, and he was shivering during vet visits, which wasn't common for him, but it was ruled out as just anxiety or adrenal crisis. This is why Addison disease is known as the Great Pretender, because it can mimic a lot of symptoms of just anxiety, which is why Addison disease gets misdiagnosed many times. And since it'll be a very late diagnosis, a lot of times it won't be a good outcome. Some symptoms of Addison's disease are intermittent lethargy, reduced play, and anxiety or adrenal crisis. I included the picture over here of when to consider adrenal insufficiency instead of just anxiety. So there's some symptoms like anorexia, weight loss, GI symptoms like nausea, vomiting, diarrhea. Other autoimmune conditions can also contribute to it, prior steroid use, and history of brain radiation or surgery. Some background on Addison disease. There's two forms, primary and secondary, and two presentations, typical and atypical. The primary form is known more as the classic Addison disease. It has both cortical and aldosterone missing, which is what leads to electrolyte crisis. Secondary stems from the pituitary or hypothalamic dysfunction, not like primary, which affects the adrenal cortex directly. Typical presentation is lethargy, reduced play, lack of appetite, and/or stress-triggered episodes, versus atypical, which is more subtle mood and behavioral changes, and most of the times it'll show normal electrolyte levels, which is why many times it goes misdiagnosed or just not seen at all. Some breeds that are more prone to it are standard poodles and bearded collies. It's also more common in younger to middle-aged dogs. So why does early recognition matter? It matters because diagnosing early can prevent adrenal crisis and sudden life-threatening collapses. Oftentimes, subtle prodromal signs, which are just early symptoms, are often overlooked or mistaken for anxiety or behavioral issues. Preventing crisis improves welfare, and I included a chart to show how, with subtle signs, misdiagnosis can lead to crisis versus early recognition. You can have prevention, like pills or treatment, which then obviously leads to intervention, and I'm covering it with the cameo, but it says wellness and resilience if you catch it on time. So some behavioral prodromes or early symptoms can be things like lethargy, reduced play, anorexia, depression, and/or stress sensitivity like shivering or apathy. Since these signs are very vague, a lot of times they're mistaken for old age or behavioral issues, GI upset, but they're actually warnings of hormonal imbalance. So stress as a trigger is one of the most common reports by owners because crises often follow stressful events like vet visits, a picture of the anxious dog, and stressor tracking and peri-stress glucocorticoid boosting is one of the biggest telltale signs of Addison disease. Dogs will show signs like reduced arousal, apathy, or shivering. The way that the stress hormone response works is that from the brain hypothalamus, when the dog is stressed, it'll release the hormone CRH to the pituitary gland, which then releases ACTH to the adrenal glands, which then release cortisol, which leads to the increased heart rate, shivering, and anxiety in general. Diving deeper into more typical versus atypical Addison disease. Typical, like I said earlier, is glucocorticoid plus mineralocorticoid deficiency versus atypical, which is only glucocorticoid and will most of the time show normal electrolyte levels. The chart on my right, which I'm kind of covering, sorry, but typical Addison's, it's more clinical signs like lethargy, weakness, vomiting, diarrhea, dehydration, low blood pressure, and collapses sometimes, versus atypical, which will only be lethargy, poor appetite, weight loss, and or vomiting. A case example would be a mixed breed dog with normal sodium levels, but the ACTH stimulation test comes back positive. So with typical Addison disease, you will see that immediately with bad electrolyte levels, with low sodium and high potassium, but with atypical, it would go normal, so it's many times often missed, and which is why it highlights the need for deeper endocrine testing. The neuroendocrine part of this disease is based on the HPA axis distribution. The hypothalamus, pituitary, and adrenal glands are what regulate the stress responses. Addison disease results in cortisol deficiency, which is what leads to mood instability and apathy. The cortisol deficiency is what affects the MR and the GR roles in brain function. It's due to the MR and the GR balance. The MR and the GR, MR being the mineralocorticoid receptors, are what control basal arousal and feedback, and the GR, which are the glucocorticoid receptors, are what handle the reactive stress responses. So the imbalance between them is what later leads on to the mood instability, and the cortisol deficiency is the reason that there's an imbalance. Enzymes 11 beta HSD1 and 11 beta HSD2 both modulate cortisol metabolism. 11 beta HSD1 regenerates active cortisol, and 11 beta HSD2 inactivates cortisol, which is what allows aldosterone to act. MDR1 transporters at the blood-brain barrier also influence how much cortisol reaches the brain, which is what adds variability between dogs with Addison disease. The figure on the right shows how in Addison's the pathways are disrupted, which is what affects brain regions like the hippocampus and the HPA axis. Although there are many diagnostic struggles, there are ways to diagnose it early, starting with resting cortisol levels. If they are above 2 micrograms per deciliter, then it is very unlikely that it is Addison disease, but if they are lower than 2, then it is best to follow up with the ACTH stimulation test. Since electrolyte levels mainly show normal in atypical cases, it's not good to rely on them alone. It's also important to monitor aldosterone and renin levels to see the progression of the disease itself. And lastly, take owner's observations as very important diagnostic clues. Many times there's only subtle mood and behavior changes, so it's very important to take a timeline of each thing that happens so that the outcomes can be improved. In conclusion, it's very important to notice subtle behavioral and or mood changes in dogs because they can be early signs of Addison disease. These changes stem from neuroendocrine imbalances, especially disrupted MR and GR signaling, and HPA axis dysfunction. Early recognition is important because it can prevent crises and improve quality of life. This topic was interesting to me because it really calls for more longitudinal research and advancing veterinary endocrinology, because currently there is no cure for Addison disease, just treatment, so it's really important to try and find better outcomes for our canine companions. Here are my references, and thank you so much for listening to my presentation.